Is monkeypox the next global pandemic? Some health experts suggest it might be. But when you take a closer look at the statistics, an interesting pattern emerges. An overwhelming majority of cases are found among men who have sex with men, including gay and bisexual men. In the US alone, there have been over 30,000 reported cases of monkeypox, with nearly 90% of those cases occurring among men, specifically gay men. Despite this, neither researchers nor organizations are labeling it a gay disease. In fact, the World Health Organization, WHO, explicitly denies such a classification.
As WHO, to work with our partners in communities and elsewhere to make sure that the messaging is correct. So while, for example, we're seeing some cases amongst men who have sex with men, this is not a gay disease.
So why is this? To understand more, let's first explore the nature of the virus, where it came from, how it started, and how it's primarily spreading in the current outbreak, especially within specific communities. Despite the clear data, the question remains, why is there such hesitation in associating this virus with one demographic? According to health organizations and recent research, the monkeypox virus, a close relative of the smallpox virus, causes monkeypox. Its name comes from the fact that it was first identified in monkeys back in 1958. However, scientists believe the virus naturally thrives in rodents, particularly in Central and West Africa, not monkeys. These rodents include animals like rats, mice, squirrels, and porcupines, known for their constantly growing incisors. Despite its discovery in monkeys, the first recorded case in humans occurred in 1970 in the Democratic Republic of Congo, within a rural area surrounded by rainforests. Since then, cases have been documented across several African countries, especially in villages close to forested regions. Over the past few decades, outbreaks of monkeypox have spread to other parts of the world, often linked to the exotic pet trade. But the story behind monkeypox that's currently making headlines is much more complex. Why is it all over the news now?
As the number of cases of monkeypox continue to rise around the world, the World Health Organization has warned that the risk of monkeypox becoming established in non-endemic nations is very real.
More than 1,000 confirmed cases of monkeypox have now been reported to WHO from 29 countries.
In May 2022, over 200 cases were reported across various countries, including Europe, North America, Israel, and Australia. And here's the twist. Most of these cases were found in gay and bisexual men. Reports show that this disease is spreading within specific communities, yet the World Health Organization, WHO, insists that it's not a gay disease. Is this disease a death risk? Not exactly. While monkeypox can cause severe blistering and skin lesions, with painful sacs forming on the bodies of those infected, it's not commonly fatal. The WHO reports a mortality rate between 1 to 10%, meaning that out of every 100 people infected, 1 to 10 might die. Those with weakened immune systems, such as individuals with HIV/AIDS, are particularly at risk. This raises questions. How can monkeypox be so lethal, in some cases, especially within vulnerable populations, and yet not be labeled as a disease affecting gay men? The logic feels contradictory. What's more, monkeypox can lead to other severe health complications like blindness, pneumonia, and even brain damage. Still, these cases predominantly appear in gay and bisexual men. If it's not a gay disease, why is it primarily affecting this group? The WHO continues to maintain its stance, but the patterns of infection spark a bigger conversation. What's the real story behind this outbreak? What's causing it to spread among such a specific demographic? The World Health Organization acknowledges that monkeypox spreads through close contact, but they stop short of calling this contact what it often is: sexual intimacy. They frame it as close physical contact between individuals, avoiding any direct mention of sexual behavior, especially between men. Their statements seem carefully worded to avoid targeting the gay community. But this raises an important question. Why is monkeypox predominantly spreading among gay and bisexual men if the virus supposedly doesn't discriminate? Health organizations and researchers insist that monkeypox is not gay disease. Yet they fail to explain why it's spreading so rapidly among gay men and not in other groups, like straight men or women. According to them, gay and bisexual men are more vulnerable because of how the virus spreads. They claim that men in these communities engage in behaviors that increase their risk of transmission. But what exactly does that mean? Are they suggesting that gay men engage in more frequent sexual activity than straight men? Interestingly, statistics don't back this up. A 2020 study published in the Journal of Sexual Medicine found that gay men reported an average of 4.4 sexual partners over their lifetime, while straight men had an average of 6.4. Suppose casual, one-time sexual encounters are responsible for about 50% of monkeypox transmission, as health organizations suggest. Why aren't we seeing a comparable spread among straight men or women who also engage in casual sex? The numbers don't seem to add up. What's even more puzzling is the claim from the WHO that gay men attend sex parties and use dating apps more frequently, and this behavior is driving the spread of the disease. But if that's the case, why aren't straight people, who also go to parties and use dating apps, reporting similar infection rates? After all, heterosexual people also engage in behaviors that could facilitate the virus's spread. So why is this virus predominantly affecting gay and bisexual men? Why does monkeypox seem to discriminate based on sexual orientation when no other factors suggest it should? This discrepancy between what health organizations are saying and what's happening raises some important questions. Why is monkeypox, if it's truly spread through behaviors common to all sexual orientations, disproportionately affecting the gay community? Could it be that the real reasons for the outbreak are being downplayed or misunderstood? The answers remain unclear as we continue to hear more from the WHO and other health organizations, but the questions are becoming harder to ignore. Another confusing stance from health organizations is their advice on stopping monkeypox's rapid spread. They emphasize practicing safe sex and avoiding skin-to-skin and face-to-face contact, essentially warning against kissing and cuddling. But if monkeypox isn't a gay disease, as they claim, why are these instructions so focused on intimate physical contact? Shouldn't the advice be centered on avoiding large social gatherings or public spaces where anyone could be exposed? So how is this virus spreading? According to the Centers for Disease Control and Prevention, CDC, monkeypox primarily spreads through direct contact with infectious sores, scabs, or bodily fluids. But in reality, it's being transmitted through intimate contact, especially among gay men. Skin-to-skin contact is the main vehicle for transmission, meaning if someone with monkeypox touches another person, the virus can easily spread. The CDC says it can even spread through respiratory droplets when someone with monkeypox talks, coughs, or sneezes near someone else. So if the virus is that easily transmitted, why isn't it spreading more widely among straight people or in the general population? It's becoming evident that the virus is spreading primarily through sexual fluids, like semen or vaginal secretions. Yet, health organizations seem hesitant to fully acknowledge this, continuing to frame monkeypox as a general infectious disease, rather than confronting the specific behaviors and communities most at risk. If anyone can get monkeypox, why is it disproportionately affecting the gay community? This is the question that remains unanswered. If the virus truly spreads through such simple means as skin contact or respiratory droplets, then why are straight people not reporting comparable cases? Something about the narrative isn't adding up. As for reducing your risk of getting monkeypox, it seems the underlying suggestion is, ironically, just be straight. And while that's not a serious solution, it does point to the uncomfortable truth that this disease is affecting certain groups far more than others. For those wondering about a cure, there is no straightforward remedy for monkeypox at the moment. While most cases resolve on their own, the best preventive measure is avoiding intimate contact with anyone who shows signs of infection. The lack of substantial research on monkeypox raises questions about whether there's truly no cure or if health organizations are withholding information. It's an intense and confusing situation, especially for gay men, who seem to be the primary group affected. Historically, diseases disproportionately impacting gay men aren't unheard of. So why does it feel like there's little urgency to eliminate this disease? Current reports suggest that most people recover from monkeypox on their own without the need for treatment. But what about those at high risk of severe illness or death? It seems odd that despite reports of fatalities, the approach remains symptom management rather than a focus on curing or halting the disease entirely. Right now, hospitals and clinics are only treating the symptoms of monkeypox. This means that while antiviral medications like tecovirimat, Itpoxx, and brincidofovir, CMX001, are being used, they only reduce the severity of the symptoms rather than cure the infection itself. These antivirals work by preventing the virus from multiplying, which helps control symptoms like fever, headache, and body aches. But they don't eradicate the virus. Similarly, antibiotics and supportive care focus on reducing complications, but again, do not target the virus directly. Interestingly, the smallpox vaccine is 85% effective in preventing monkeypox. Yet, medical research doesn't seem to be prioritizing this as a potential pathway for finding a full cure or treatment. This adds to the confusion. Why is there not more emphasis on utilizing the smallpox vaccine to combat the spread of monkeypox more effectively? If there's one clear thing, prevention remains key in avoiding infection. So how can people protect themselves? Avoiding close contact with anyone displaying monkeypox symptoms is crucial. Practicing good hygiene, such as regular hand washing and avoiding touching or kissing someone with sores or rashes, can also help prevent transmission. But despite these preventive measures, the alarming part is that health organizations still seem to downplay the severity of the disease, even though 90% of reported cases are in gay men. The numbers don't lie. Monkeypox is disproportionately affecting the gay community. While there's no definitive explanation as to why this disease continues to be framed as a low-level threat, it's important to recognize who the virus is truly impacting. The question remains, why isn't more being done to find a cure or a more effective treatment, especially when a specific community is so heavily targeted? What do you think the medical and research sector is trying to hide from the general public, gays especially? Put your thoughts into the comments.